Welcome to Wellness Radio with Dr. Jeanette Gallagher as your host. Her show discusses topics of health, wellness, and spirituality, and is about discovering your place in this great universe, from your cells to the cosmos. Along with her guests, in casual conversation, she strives to ask the difficult questions that may be holding you back from a vibrant life, and shares new ideas that may inspire you to make a change in your life that you only can see in your dreams. And now, here is Dr. Jeanette Gallagher.
Good evening, everyone, and welcome to Wellness Radio. This is Dr. Jeanette Gallagher, and it's a pleasure to have you with us here this evening. Tonight, we are going to be talking about the most influential word in almost all of our dictionaries these days. What always is coming up? Money, healthcare, survival. What is it all about? When you start talking about those conversations with others, boy, oh boy, you can get a very heated conversation. You could almost end up in a whole lot of trouble if you say something that you believe or you feel as a change. However, others, too, are still stuck in their old times, their beliefs and their thoughts about what healthcare is about, how we can pay for it, who is paying for it, and when the cuts start to come up, whose dollar is on the table. That's pretty much those heated topics that we want to talk about. But it will definitely bring up something for you. The answer is there is no right or wrong. This is a changing paradigm. I've been in healthcare for over 5 decades, and you can definitely see the change. Problem is, in the year 2025, you can't just say, let's click our fingers and now the change is here and everything else falls away. We are on the bridge, so to speak, between what we would like to create, what we know is better, what we know is more human for people in the process, and on the other side of the bridge is the way we used to do it. In the middle is the chaos. That is where we reside today. That's what we'll be talking about today. My guest is Ray Kober. He's the founder of Benefixa, and he also has a podcast, Broken Healthcare. Can we save it? Which dives deeper into the healthcare and insurance industry. Ray, thank you so much for joining us today. It's a pleasure to have you with us.
Oh, it's a pleasure to be here. Thank you so much for having me.
So glad to have you because, boy, this is a hot topic, but we can mesh around in the pot all we want. We will do that today, but we also know that we still have not reached the other side of the bridge, so to speak, don't you think?
You know, where is the other side of the bridge? If you ask anyone what they think of healthcare, chances are they're gonna the word on the tip of their tongue is going to be broken, which is why our podcast is named Broken Healthcare. And to be fair, certainly not everything in the system is broken, but boy, can we do so much better at it than we're doing today. And that's really what I hope people understand, is that they don't have to work within the confines of the system that they're given. If they go beyond that, and we have some great medical professionals out there, there's a whole universe to explore that may serve them a lot better than the traditional healthcare system.
If we really look at it over the decades, I grew up in the 50s. I distinctly remember, the doctor would see you in the church or he'd see you in the grocery store. If you fell down, he'd say, come see me, let's go walk over. He knew how you fell. He knew what to do. He knew how to take care of you. And, hey, okay, pay me what you can. And, I know you have the bakery on the corner. Just send me over some baked goods. It was a good thing. Problem is, We've now come to the place where there's so many more people. It's a grab and take, and it's all about consumerism. There's nothing in healthcare that you can say that has any other definition other than consuming. Everything is consuming.
Yeah.
People want it. The companies want it. The people and everybody in the middle wants it. And it's all about money, when truly it should be about health. But really, if you look at it, if you're asking a patient, I really want health. No, they want to consume. They want to get. They want to receive. And I had written this down this morning. I said, humanity, and they really think it's about saving them so they can survive and exist, right? However, the industry said it's about money, but they really need money too because they need to survive and exist. So everybody is coming to the same conclusion. We're doing this because we can, because this is what we believe will allow us to exist. So are we really talking about the same thing? We're not. All of these other things are just tears on the tree, so to speak. You know, that whole paradigm, what's the root cause of disease? I don't think there's a root cause, but, hey, existence definitely is a trunk of the tree, perhaps?
Yeah, there's a lot to unpack there. I think when you go back to, I wasn't around in the 50s, but a short time later, I was born in the 60s and you know, into the 70s and on. I think physicians get into the medical practice and they become physicians for all the right reasons. I think they want to help people. And I had my wife's cousin, Charlie DiMaggio, on, who's a physician's assistant, and he has had a long, you know, storied career working in emergency medicine and one of the busiest ER hospitals here in New York City, Elmhurst Hospital, and he works in the Department of Corrections. And he went on to academia and is a professor at Columbia. Brilliant guy. And we had a conversation about a family physician, and his name was Dr. Valicenti. And whatever was wrong with you in their family, they would go to Dr. Valicenti. And Dr. Valicenti wouldn't send you to a specialist. He specialized in everything. So if you needed to have a baby, you went to see Dr. Valicenti. He took care of the obstetrics. If you had a headache, you went to Dr. Valicenti, and he would care for you. And so there was very much that community-based system that we've really lost touch with. And it's a shame because a lot of it, to your point, Doctor, is in the name of profit. And I think a big part of what's wrong in healthcare today, and I will say for the record, I'm a capitalist through and through. I love this country. I love America. I believe in a capitalistic society, and I think I think we're really fortunate to live in this country in this time. If you think about it, we've all kind of hit the lottery when it comes to human existence. But that said, we have a for-profit system, and so the United Healthcares, the Cignas, the Blue Cross Blue Shields, all of the bigs are publicly traded entities, and they have a fiduciary responsibility to their shareholders. So they are obligated, their first obligation is to return a profit to their investors. And that works well in our society. However, when you dig a little deeper and you say, well, what's on the other side of the equation? Who loses? Well, the patients lose, right? Because you can't simultaneously serve your shareholders and your policyholders. And that is definitely at the root of the problem. And it's really tough because as a healthcare consultant, I'm out there every day talking to business leadership about doing better for their employees and their people. And it's amazing, but they have this mad love affair with this insurance logo that's on their ID card. And the problem with that, Dr. Jeanette, is that insurance company doesn't dispense one iota of healthcare. They're an insurance company. And so that's definitely a big part of the problem.
I think the biggest, as I call it, light switch came about in the years 70s and 80s. We look back on that. That was when people started to go to college. You know, in the 60s and the 50s, only the rich kind of did. But in the 70s and 80s, there were a lot of scholarships and people were starting to go. So there was more education. What really started to happen was there was more information out there and it was becoming more accessible. In other words, if more people went to college, there was more people talking. And this is free internet. And when we think about it, when that happened, we started to have more doctors and we started to have more specialists and professionals and everything. Doctors started to realize that as we read and we learned more and we started to expand our knowledge base, what was happening was we were now at risk. Yes, I distinctly remember my doctor. He always came to the house when I was sick and things like that in the 50s. But then when we started to learn more and we said that doctor needs to, quote, do more and he has to know more, then he started to run in fear. We go back to the same word, existence again, or saving or survival, because he can't know it. All of a sudden, there's a new machine coming out. There's a new, hey, that's a CT and MRI. Oh, my goodness. I need to know about that. I need to know how to read it. I need to know this, that, and the other. However, it's very important to point this out because that happened in the 70s and 80s, but it is happening now in the year 2025 with AI. We are having another reboot. So we are going to have another, as we call it, cataclysmic kind of revolution in healthcare, where the physicians who were trained in those years, who are elders, who are maybe are forethinkers and says, this is what it's about, this is what I saw. And they can't share their wisdom anymore because for fear of repercussions, not saving, they don't know enough, and they're kind of getting out of the business, or else they're going under the tort law. They're going to sign up with a hospital. Hey, honey, just let that hospital take care of me. They can take on that tort insurance. I'm good to go. I'm fine, and they don't worry about that. And that came about in the 90s when everybody started selling their practices and going under big companies because they needed to be able to survive. But if you look at it, pandemic kind of blew it open. Doctors don't know everything. We cannot know everything. I've been in it, like I said, for over 5 decades, and I can honestly tell you, I do not know everything. I welcome patients. I will say, here, I don't know about this, but why don't you go research it and come back to me? And I give them the work to do because I can't do it all for everybody. And you can't do it to know everything. So I think the idea is that we want to be able to have a system that reflects the old ways, but it's not realistic anymore. AI is going to take over. It'll be doing some of that learning. It'll show up, and we almost kind of need to just sit back and let it happen, perhaps.
Yeah, so I think there are many things at play here, and artificial intelligence, as it pertains to healthcare, does have a place, and I think that there's some amazing potential for it to assist in the right setting, in the right environment. If it's enhancing the work of a physician or of a surgeon, then I think it can actually be a help. But the trouble is, we have physicians that, as you said, have migrated away from what used to be their calling of having a private practice, and they're being gobbled up by private equity, all in the name of money. And the trouble for folks is that if you now have a doctor who's your quote-unquote in-network primary care physician, most folks don't realize that physician is compensated primarily in one of two ways. One is the volume of patients that they see, and so these doctors are really burned out. It's one of the highest rates of suicide of any profession. They're expected to see, typically patient caseloads of upwards of 2,000, and then keep up with the EMR and all of the note-taking and the medical reporting. And it's become an impossible task, and so they're getting burned out. And then the other way that they're compensated is something called RVUs, or relative value units. And that's a metric for how often they refer patients within the healthcare system that they're employed by. And so if you go to an orthopedic surgeon and you ask them to take a look at your knee, and she takes a look at your knee and she says, well, I think, Dr. Jeanette, we may be okay, but I can't know for sure. We need to send you for an MRI. And she refers you to the hospital that she's affiliated with. That MRI test may cost upwards of $5,000 when we know that we can get the same exact test down the street at a freestanding radiological clinic for 1/10 of that cost. So $500 instead of $5,000. And the forward-thinking business leaders, I was on the phone with an HR executive earlier who presides over a city with a few thousand employees and more members. And she knew that there was something more that she could do, and so sought out ways to break away from the conventional system. And she said at first, I had to look over my shoulder walking out into the parking lot. People were upset. There was change coming. I felt like my tires were going to be slashed. But then they rolled out a plan which gave people the option to choose a direct primary care physician who would then guide care. And when patients and members, employees started doing that, their out-of-pocket expense went from thousands of dollars of potential out-of-pocket expense in the old plan to $0 out-of-pocket in the new plan. So it not only saved the city and the taxpayers, her words, millions of dollars in this case, but she was getting hugs from employees who would walk up to her in the parking lot and said, "This plan literally changed my life."
The healthcare industry and insurance industry, I've seen it change so much. I distinctly remember in the 70s, right here in New Orleans where I live, a very large company we were insured by, we had kids. I never saw a bill. Don't ever remember seeing a bill. Never saw any paper come to the house. Everything was taken care of. Even when I had kids, even when I had complications. Then when naturopath, when I was doing work, I never accepted insurance. Never. Just didn't. If you were invested in your health care, you had $10, I'll take $10. You invested in your health care within your means. That's great. Also, too, I would see patients who would say, "Oh, I don't need any blood work or anything done. My company does it." I said, "Oh, awesome. What's the name of your company?" And they would tell me the company name. And I said, "Okay, what kind of work do you do?" And I go, "Oh, now I know why they're doing all of those testing and everything, and they're saying you're doing great because they now have the toxins within it, and they can monitor it, and when it gets too high, they fire you." There is a lot of subjugating talking going on in this industry. I mean, you and I are only going to talk on the 1%. Let me tell you, there's 99% of the conversations that are downright dirty. Everybody knows it. Everybody has something to hide. And going back again to the beginning, they're all about survival of the self. And that truly is what it's all about. I mean, you talk about the prices of, let's say, an MRI like you shared. There's no such thing as a standard price of an MRI. There never has been. It depends on where you go. Now, I'm Medicare, and I turn around and I'm going, okay, what is this new charge that has just come on my bill, which I've never seen, these facility fees. Never seen facility fees in my life. They just showed up about 6 months ago. Problem is that there's 2 hospital divisions in this area. One bought the other one out, and now there's facility fees because now they thought they could slide it under so the people on Medicare didn't know what it meant, didn't have the wherewithal of their brains and their minds to fight it or not pay it, and just went ahead and paid it. So now they got another influx of money. Let me tell you, there's so much secrecy and there is so much downright awful work, within the systems. The difference is can you find the thread? Right. Can you find the thread to be able to have your own survival and make it through your life existence? That's truly what we're talking about. Because if you go about it and you want to stand up like a boxing man and hit down all of these things that keep popping up, you're going to be exhausted and someone's going to take you out. I know for a fact because I've had several years of death threats when I started to do things in the area. So it's very specific. What is the question you're asking and what is the answer you are seeking? So when you go to the doctor, I would need an MRI to see if I perhaps have cancer. So you're stating your problem and you're sharing your fear. Medicine is supposed to just say, how can I alleviate that fear? That's the cost, perhaps?
Yes, absolutely. I think, to your point, it's a dirty game. There are people making money hand over fist every which way that you turn. The insurance carriers own the pharmacy benefit managers that have nothing to do with manufacturing a drug or dispensing a drug at point of sale. They're simply in the middle to buy a drug low and turn around and sell it high to members. And that's the experience that most of our people have. Dr. Jeanette, we're spending 20 cents on every dollar in the United States goes to healthcare. It's an incredible, it's a fifth of our gross domestic product. And, you know, you and I had a little bit of a conversation about it being a bubble before we jumped on, and I had to laugh because, you know, when is this bubble going to break? And one of the first guys that actually kind of brought this on my radar, his name was Marshall Allen. He wrote a great book called Never Pay the First Bill. And he was a journalist, an investigative journalist, who passed away, unfortunately, prematurely last year, tragically. But he was a champion of the underdog, and he wanted people to know that if you're one of the 100 million plus Americans that have medical debt, you don't have to pay the bill that the hospital or the physician practice sends you. You have a dog in this fight, and you need to stand up for your rights. And it's an incredible book for any of your listeners that might be receiving, you know, collections notices from medical providers. I highly recommend it. And he basically maps out what someone has to do to fight the system and successfully help people, you know, just kind of clear their good name and, you know, save people literally from bankruptcy. And the number one cause for bankruptcy in the United States today, believe it or not, is medical debt. It's a huge drain on our system. And, you know, it's not only a drain on our system, but think of the psyche of people that are burdened with this, saddled with this debt. What is it doing to their mental state, to their emotional state, to their physical being? It really is a huge problem, and we have to do better.
I distinctly remember, I think it was a year, maybe 1985 or 1990, and I worked for an insurance company on credentialing physicians. You would be astonished at the amount of physicians that did not have a medical license that was active, or people who had cases against them, yet they were still working under under the insurance umbrella of a hospital or a big conglomerate. And they kind of just did their own thing. And you think back on it and you go, okay, but that doctor sent me a huge bill, and we think about it, and as you shared, what is a bill? Bill is for services rendered. No, a bill is not for services rendered. A bill is I think that this is the value of this time that I engage with you. That's what a bill is. It is not for services rendered. No way. Because if you think about services rendered, it has a finite thing. If I sit here and I put a tire on your car, I'm charging you for the tire, the air, and for alignment. That service is rendered. When you go to the doctor, they're now itemizing things out, as I said, with those additional fees. If you come in now and you sit down on the table, you just dirtied my table, so that's called a fee, and now I'm going to charge you for that. I put a blanket on you, now I'm going to charge you for that. So now they are what we are calling double dipping, because they have already charged you for the room and the services, which is one fee. But now they're saying, but now if I bring something in there or there's something in there that you touch, I might have to replace it, so I'm going to do an additional double dip charge, you see. Yeah. So to say that a bill is for services rendered is false. A bill
no doubt
is for the engagement of the moment. That's it. And it's up to my discretion of what I perceive to be. And if we could wrap our head around that, I mean, how profound would that be? That would create an absolute war. And as I shared with you before, is healthcare is going to implode. It is going to go the bottom up. It's going to happen because it just has to. There is no other way to be able to do it. People are now learning how to take care of their own health. They're like, I'm not going to do that. I mean, physicians get paid. I mean, I have this one patient, male, just got onto Medicare, 6 diabetes drugs, 4 heart drugs, 2 or 3 diuretics, and he went into the visit, and because he was having, I just need to get my prescriptions looked at or whatever. Never had a physical exam. And I would ask patients, I want to know one thing. Tell me the last time you had a physical exam. What is a physical exam? It's not symptoms. I'm not pointing out because I have a sliver in my finger or because my shoulder hurts and he touches it. Physical exam is top to bottom. And I can guarantee you 100% will say 0. But what does the doctor get paid on? The doctor gets a stipend on people that have blood work, and the blood work comes back better. They did not get anything for, I looked at the patient, I saw this, I found this, I checked this, he might have that. No, that's a perception. They're only getting paid on the blood work, and did it show up differently, and you had a good outcome. So now you get a bonus. There's a huge discrepancy in the idea of what healthcare is, what the insurance industry is about, and how that is traversing, perhaps.
For sure. If you look at bill charges, there's something called the charge master. And the charge master is something that hospitals now have to make publicly available. And they've cleverly figured out a way to make them available in these machine-readable files that no one can possibly decipher. You have to be a computer technologist to figure out what the cost of services are. And they use CPT codes, which designate what they're billing for, the procedure. And it's not uncommon for a hospital to have over 200 different prices for the same exact procedure. And, you know, when you think about it logically, does that make any sense whatsoever? Of course it doesn't. So we're playing in a rigged game, and one in which the doctor is not incentivized to care for the patient and to treat the root cause of the problem. We have a medical force that by and large is trained to diagnose and prescribe and move on to the next patient, because that's the system that we're in. And so, you know, I'm a freedom guy. I interviewed Dr. Jack Wolfson, who's America's number one natural cardiologist. And he is an amazing guy. And he said, look, I'm a freedom guy. If folks want to put poison into their body and alcohol and drugs or whatever it may be, he said, I'm not here to stop anyone from doing that if that's what they want to do. But you're not going to get me to do that, and you're not going to get my family to do that. And so I think people need to be their own best brand steward of their health by first just recognizing that we got to do a better job. If we want to live pain-free and we want to be healthy, then the best thing that we could do to reduce the cost of healthcare is to limit, you know, the amount of toxins that we put into our body and get out there and get ample exercise and all of that stuff. So I think that's something that's important for folks to know. And I'll share with your audience that I'm no better than, you know, any of your listeners. I found myself a few months back way overweight, eating the wrong things, drinking the wrong things. And I had to look at myself in the mirror and say, you know what, Ray, you don't like the way you look. You don't like the way you feel. You got to do the work. And what is the work? The work is, well, you know, if you're going to enjoy an alcoholic beverage, don't do it every day of the week. Do it once in a while. If you're going to, you know, eat processed foods, don't do it every day of the week. Do it once in a while. And, you know, I'm happy to tell you that I was able to drop 25 pounds. All my numbers got way better. And so it's within most people's grasp to do a better job with themselves. And guess what? You do a better job with yourselves, you don't have to go to the doctor, right? But if you are going to the doctor, you shop for everything under the sun on Amazon, at Walmart. You look for the best deal for this or for that. But when it comes to, a knee replacement, you're going to blindly trust a doctor because he's in network and close to your house. Well, there's more to it than that. And so are you getting the best quality? Are you getting the best price? Do you have a system that allows you that gives you the tools that allows you to navigate this? Most folks are really ill-equipped to do these sorts of things. And I think to your point, we have to do a better job because we just can't afford it anymore. People can't afford to go to the doctor when they have a need, and when they're prescribed medication. We know many folks out there are not taking their prescribed medication because they simply can't afford to pay for the drugs that realistically should cost a fraction of what they do in a traditional health plan.
For our last little bit of time, Ray, I wanted to touch on this topic too. I truly think it comes down to this. We have not settled on to the value of the human. Humans are pretty much disgusting to some of the people on the earth that they choose to have judgment about. They are. They go after them. They have vengeance. Judgment is up the wall. We know this. Oh, I'm healthy. You should be healthy. Oh, I'm sick. Why can't I get fixed? You know, all of these things we have all of these judgments about. But yet we are always asking the companies to be able to put a value on the human life. People who are very ill. I work with chronically ill and end-of-life patients. Okay? They don't want to be saved anymore. They're done. Their life is finished. They're good with that. They've made peace with that. But it turns around is that what is the value of that human being? You know, we're asking the companies to provide services to save us, to hold us in, to take care of us because we're a human being. We paid into it. We are asking them to what is the value of your health? That conversation can't be had because no one in the world is willing to stand up and say, I value all humans in their own space and time. Because you're constantly putting them into silos. We want to put the sick people over here. We want to rate them higher. Put the well ones over here. Hey, they're doing good. We'll put them over here, you know. We'll give them a discount and all this other stuff, you know. And we look at it, and we are constantly still doing that. It's even more so now, I would say, than in the past. It's very much a judgment call. You know, I'm going to judge you. Stand in front of me, I'm going to judge you. Doctors are going to judge you whether they see you or not. I can't tell you. Another patient came to me and they said, well, I had a primary care for a while and I had to cancel 2 appointments and she said she's just not going to take me back anymore. And I didn't know that would happen, you know, or, you know, and it's just such a judgment call that people they're really taking it to the nth degree. And I think that's where it's going to be the tipping point that was going to pull healthcare out from the bottom. Because if we don't start to value everyone and everything, hey, if you're buying a bottle of vitamins, someone's in the store next to you looking at it and sets it back on the shelf, say, hey, would you like to buy that? Here's some money. Let me buy it for you. Whoa, talk about a paradigm shift. Do you know what I mean? Or if you go to pay at the doctor, you know, just when you go to the restaurant, you say, I want to pay it forward for the homeless. I'll buy a plate, put the receipt up. Someone comes in, they need it, they take it. Did you ever do that at the doctor's office? Say, hey, do you have a bucket there we could put some money in if a mother comes in and she's single with her child and can't afford the prescription? Can you give them some money in a discount card? Are you kidding me? No way. The value of the human has totally become defunct. And I think that's going to be the basis of the process.
Well, I agree with you. I think as a society, we've gotten away from our roots, and technology is a beautiful thing, but it's also a horrible thing. And we've gotten to a point where we've degraded as a society, and what do you see all over social media? It's all vitriol and hate speech, and it's attacking folks and. I have no patience for that. At the end of the day, we're all human beings. It's not easy to be the perfect human being. I don't think anyone is perfect out there.
Right.
Everybody has demons that they battle, and no one should be shamed for where they are today. We should be more supportive of one another and say, you know what, you're here now, you're presently struggling with this, but we can help you. There is a path forward. I think it starts with oneself, though. And I think part of the process is we need to tune out the noise and the negativity. And, if that's what you're feeling when you're on social media, hey, get off social media. If that's the people that you have surrounding you are negative Nellies and they're just kind of, just spewing nothing that's healthy, get away from those folks. Find new friends. It really starts with oneself. And I think if we do a better job of caring for ourselves, it makes things better. And I will tell you that I am encouraged about the direct primary care movement that is taking place in this country, where doctors have broken away from private equity and all in the name of money and gone out and started practices where instead of waiting around in a waiting room for 2 hours and a doctor spending 15 minutes with you and shuffling you off, they've flipped the script. So instead of spending 2 hours, now you're spending 10 to 15 minutes in a waiting room, and they're spending an hour with you, and they're getting to know you, and they're asking, what's wrong? How can we help? Mm-hmm. And then if there are issues, they're guiding your care. So I don't think it's all, gloom and doom and
right.
bleak and dreary. I do think that there's cause for help, but we need folks to be better brand stewards of themselves, to speak up, to ask questions. Maybe if we talk again, we could talk about some of the dogma that's recently been overturned regarding cholesterol. And, most physicians, even to this day, will tell a patient to go out and get Lipitor and get on a blood statin, when we know that statistically speaking, the purpose of that drug is to reduce the risk of heart attack and stroke. And the studies show that it reduces the cholesterol numbers, yes, but the efficacy of reducing the incidence of heart attack and stroke is less than 1%. And we have millions of Americans walking around on Lipitor. So, these are the types of things that people need to be more engaged. And it's an area where maybe AI can actually be a positive if folks start to do their own research and they walk into their doctor and they push back and they ask questions. Why are you prescribing Lipitor if it's showing the incidence of efficacy is less than 1% in dealing with heart attack and stroke? See what they have to say.
The answer is standard of care. You're required by law, under the standard of care, to follow the rules. The rules are the dogma of the profession. Physicians can't do that just off care, because when they go into court and there's some kind of an adverse effect, or there's some kind of legal case that you're coming up with, doctor did not follow the, quote, standard of care. The difference is the standard of care, since the Internet came about in the 90s, has now been on warp speed, and no one can keep up with it. So the standard of care is something that has been written in gold etching for decades, over time from the 40s all the way up to the 90s. But once the 90s hit and the Internet came about, standard of care has been like, it's almost vibrating itself to pieces. It's starting to, as we said before, implode. But however, you're not able to find who is the ruler that's going to set the standard of care, because it's changing so much. So once we get on the other side with AI, the standard of care will change. Standard of care will be something different. I know for myself, being a naturopathic physician, we're primary care physicians in many states. That is what we do. First patient, when you come to me, 2.5, 3 hours sometimes, because we're really truly looking at everything it needs to be, and we follow up. You ask any other patient or any elder, when you went to the visit, did the doctor call you up and bring you back in to discuss your labs? No. Did the doctor make a follow-up appointment? No. Did the doctor do a physical exam? No. And you're going, okay, so they just took care of me for the day and gave me a prescription, and that's it. So there is a very broad paradigm in which we have access to, and the point is that everybody is kind of accessing little bits and pieces and trying to form their own standard of care, don't you think?
Indeed, it's changing at a breakneck pace. Folks need to be their best brand steward. They need to advocate for themselves, and standard of care and dogma isn't always right. If you look at the recent publication of the book Blind Spots by now FDA Commissioner Dr. Marty Makary, Johns Hopkins trained, there are many dogmatic beliefs that have been completely debunked. The double-blind clinical, studies have been proven statistically to be false, and so if you have docs that are just falling back on their training and they're not keeping current with the literature, they could be doing more harm than good. And so,
Right.
it's fascinating read. Yep.
But right there, Ray, hold on one second, because let me tell you, here's another, let's expose it for what it is. Clinical trials are done by those which are going to benefit from it. Who provided the drug?
Ain't that the
truth? Who provided the supplements? Who provided the services?
Right.
Who provided the doctors that are doing it? Where were they trained? How was it done? Under what auspices? There's no such thing as a true clinical trial. My sister, she is the head of clinical trials across the country. My daughter is an ER physician. My son does mental health crisis care. We're all well versed in this. And every day we're going, yep, but there it is. Every time, there it is. It pops up. Because it truly, there is something different. As we would say, here comes another little thing that's boiling to the top. Perhaps?
Yeah. Oh, for sure. It's fascinating when you hear the dogma and it's kind of, ingrained, like, don't eat a diet that's high in saturated fats. Stay away from eggs. Anything that will spike your cholesterol will kill you. And then you have a team that's brilliant scientists that go back and they check the study and they say, you know what? The smoking gun is not cholesterol. And your body produces its own cholesterol. How about getting out into the sun and exposing your skin to the sunshine, which will convert into vitamin D and give your body natural cholesterol? How about the dogma that had the women stop taking estrogen for hormonal replacement therapy because there was an obscure study that showed a higher incidence of breast cancer? And how many women out there were deprived the benefit of hormone replacement therapy, which would have made their lives exponentially better because of a bad study? And you go on and on. So I think the message is physicians are not the villains, but trust and verify. Don't be afraid to ask questions. Do some research, do some diligence. And if you're prescribed a medication and you're not asking why, then shame on you. And if you're prescribed a medication and you start to take it at the advice of your physician and you don't feel right, you don't feel good, it's time to ask some questions and get to the bottom of it. Be your own best brand steward.
And my takeaway would be is that realize you're an individual. If someone over there is on a carnivore diet and it works for them, that's awesome. If it doesn't work for you, it isn't for you. If a plant diet is for you, then you go to those that are propagating that theory and are being able to be well educated and say this is the way we can go over here. There are many leaders in the world in healthcare. All you have to do is just find something that works for the minute. However, you also have to understand, I may go along with this process, and I may need to shapeshift. I may need to toss it out altogether. I may need to find my own way into something else because I am now in a different place. I think it's going back to the beginning of what we talked about today in closing is the value of the human, but it's also about the individuality of the human. We know this in the healthcare industry. We know this in insurance. We'll have to talk about this on another time. But insurance puts you all into a silo. Hey, you're a woman. You're this age. Boom, you're over there. And the individuality of all of our signs and symptoms, it has been blown out of the water to the point where now mental health is greater than the physical symptoms now. Because people are being told, well, that's not what you have. That's not what you have. I can distinctly tell you, during the pandemic, I was having an intense pain in my head, and I have migraines all the time. I went to the ER. I swore I was having a stroke. It was so violently bad. The doctor wrote on the bottom of the thing, altered mental status. Guess where you're going next? You're going to see a psychiatrist or a psychologist because I don't know how to fix you, and because we couldn't find it on the CT. And there's our loop. If I can't see it on the test, validate it as such, and get paid for it, there's the crux to the healthcare industry. And that is the problem. is that we have no way of having individual care these days. Or, again, the human value, don't you think, in closing?
Agreed. Yeah, I think it boils down to common sense. Ultimately, look, if you're listening and you're a chain smoker and you drink a quart of bourbon on the daily, and you want to ride your Harley through a wall, more power to you, right? We're not here to tell anyone how to live their life, but it's important that if you're in pain and if you're inflamed and you don't like the way that you feel and what's going on, you need to get involved. And it can't be as simple as going to the doctor that's in your network, that's your primary care physician, that's frankly just not equipped to care for you. You need to think beyond that. And, for more than half of Americans, they get their coverage through their employer. And if they're in that type of a system and it's not working, know that there is a better way. There is a path towards finding a physician that can give you the time that you're not getting right now, who will be an advocate for you, who will, put you on a path to healing if that's what you want. So we have the power. It's just a matter of kind of cutting through all the muck and mire and saying, we're not going to do this the traditional health plan way, because that's obviously not working. We're paying tens of thousands of dollars a year for an insurance policy that we may never use, and if we need it, it may not be able to support us when we need it. That's functionally uninsured, and that's where most people are, unfortunately. So we have the power. Your listeners, your audience should know that we have the power to change this and to fix it. And the path is to listen to smart people like you and the guests that you have on, and think outside of the box, think differently, because there is a better way.
Ray, can you share with the listeners how to find out more information about your work?
Absolutely. So you could find us on YouTube at Broken Healthcare Podcas, or wherever you consume your podcasts, Apple, Spotify, etc. And you can reach out to me directly. It's Ray, R-A-Y, at benefixa.com. That's BENEF, like Frank, IXA.com. Happy to engage anyone that has any questions.
Absolutely. Well, Ray, it was such a pleasure to have you with us here today, because this is such a Pandora's box for many people. They're like, no, that's not true. I don't believe that. And the answer is perhaps. We don't want to say it's right or wrong. It's just perhaps. And what if, right?
Perhaps. Indeed.
Perhaps.
Thank you so much, Dr. Jeanette. It was a great pleasure.
Thank you. If you'd like to find out more information about Ray Kober, again, his podcast is Broken Healthcare, Can We Save It? Please do click on the link on the bottom of today's show page to go directly to the link to find the podcast, also to be able to find his company, which is Benefixa. It truly is about being able to say, when you go into a doctor and you ask him the question, at a new doctor, first question should be, hey, doc, who pays your bills? Who pays you? Who pays you? Who pays you? Is it the insurance company? Is it the hospital? Oh, well, I'm under the hospital. Oh, I have a private practice. If he does not say, the first words are, you pay me by offering services, then you've got a problem. That's the time to turn around and say, he has other vested interests. It is not you. It is someone else. Wake up. Pay attention. Healthcare is going to implode. I might not be around, but you definitely remember I said it. So thank you so much for joining us today. This is Dr. Jeanette Gallagher. Until tomorrow, have a great day.
Today we discussed many life-changing concepts. Who do you turn to, and how do you know what is best when faced with a health crisis? Dr. Jeanette is a patient advocate. She listens to the patient, the doctors, and the family, clarifies the health issues and concerns, then helps the patient make the best choices going forward. If you would like help implementing change into your life and health, we can talk and see where you are stuck and how to improve the quality of your life. Check the link on the bottom of today's show page or visit drjeanettgallagher.com to schedule a phone appointment today.